Thank you for joining us for this special series of This is Getting Old. Sponsored by the Health and Aging Policy Fellows Program, Capstone Conversations is brought to you by Melissa B., PhD, in collaboration with the George Washington University's Center for Aging, Health, and Humanities. Welcome to This is Getting Old. I'm your host, Melissa Batchelor, and today we're going to be talking about bringing Washington, D.C. healthcare policy experience to Quinnipiac University. And I'm joined by Angela Maddie and Matthew O'Connor. So welcome to both of you.
Thank you.
Thank you.
So before we begin, maybe each of you can introduce yourselves and explain who you are and kind of what you do.
Thank you. We're delighted to be here, Melissa. And like you said, we're from Quinnipiac. I'm a professor of management and medical sciences in the School of Business and Medicine. I also direct the long-term care compliance program. And past year, I was a health and aging policy fellow with the placement and representative Dolores office. And before being an academic, I had about 20 plus years in hospital and healthcare. I started my career at the Hospital Association doing risk-adjusted studies on a large database, and I moved to Anthem in the corporate office of medical policy. And from there, I was on the executive staff of a large healthcare system responsible for all things I like to call cost centers rather than revenue centers, quality, legal, et cetera. And I think it's important for college professors to stay up to date and also contribute to the community. So I participate on a number of boards. I'm a trustee for Trinity Health in New England and also their chair of their quality committee. I'm on the quality committee of St. Mary's. I'm on a committee associated with Yale New Haven Hospital. And I enjoy bringing that back to the classroom. So thank you again.
All right, great.
I'm Matt O'Connor. I'm the Dean of the School of Business here at Quinnipiac University. I'm also a professor of finance. Just a little bit about our school. We have just over 2,000 students in the School of Business, and we offer both undergraduate and master's programs. And Quinnipiac and the School of Business has a long history of working in the area of healthcare management. Angela is just one of our professors in that area. And in addition to my role at Quinnipiac, I'm also a board member for UMH, which is a senior living and care community here in Connecticut.
Okay, well, welcome to both of you. So I guess the first question I have is, why do you two think that it's important to train the next generation of healthcare leaders in healthcare and aging policy?
That's easy, Melissa. There's a dire need. The Institute of Medicine landmark report, Retooling for an Aging America, Building the Healthcare Workforce, stated that unless action is taken immediately, the healthcare workforce will lack the capacity in both size and ability to meet the needs of older patients in the future. You know, we all know that the elder population is growing. When we look at the statistics, it's amazing. By 2029, all boomers will be at least 65. So that means 70 million Americans. It's estimated that by 2030, 3.5 million additional healthcare professionals and direct care workers will be needed. So it's been called a crisis in staffing and healthcare. So, you know, the other thing that's important is to also train people on what goes on in DC and how it impacts every aspect of the delivery system. It impacts how providers are reimbursed. It impacts how quality is measured, how monies are appropriated for programs, for research, for NIH. A lot of graduate programs may have some training in healthcare policy. There's not as much as there should be. And many of these programs don't have emergent programs like provided by the fellowship we'll talk a little bit about. And you know, because you were on the Hill, Melissa, and I had the opportunity to do it twice, that unless you're there and can really experience how things are done or how the sausage is made, you really don't get the full perspective. You end up with just a theoretical perspective. So given the aging demographic, given the lack of providers to take care of these people. Given the need to train graduate students, practitioners, and health policy on how things impact their business, how they're going to take care of their patients, it's really important to train both in aging policy and policy in general. So thank you for the question.
Yeah, Melissa, that's a great question, and it is really critically important. The training of healthcare leaders and particularly in aging policy. When you think about a healthcare organization, there's really two critical areas. There's the clinical care that's provided, and obviously that's front and center. But all clinical care is provided within an organizational framework. And those organizations have to function well. They have to have good leadership, good strategies. They have to be able to execute on tasks. They have to be able to have good, management policies and HR policies and good, quality control and how they monitor all of that. So it is really critical to be able to train people, in how the organization needs to function in a very high quality environment. And part of that is really training people on, as Angela said, what are the policy implications that arise not only out of Washington, but maybe out of your states as well, for those organizations and for the people delivering the critical care. So it's important that we train people in how to run these organizations very well, very effectively. Everything from finance to operations to HR. But a critical part of that also has to be understanding how policy is developed and the implications that both national and state policies have on the ability to deliver high quality care. And as Angela said, a big part of this is also, just the demographic changes that are coming and how our population is shifting proportionally to have a larger proportion of older people who are going to require lots of new settings and not lots of new types of care. And so making sure people are aware of that and ready for that and ready to innovate around that is going to be critical, for our society.
That's true. So I agree with all of that. And now, we've seen some hospitals struggling now with the infection control part, which is, a finance and the operations piece. So very timely topic for us to be talking about. So what do you consider to be the important pillars of training for the next generation of healthcare leaders?
Yeah, that's a good question. I came from association and from an acute care setting. And what I saw over and over is healthcare professionals tend to have pods or domains. And I also saw that when you begin to do root cause analysis, you realize a lot has to do with communication and handoffs that lead to patient errors. So I think the key pillars in training healthcare leaders is an interdisciplinary focus, that the practitioners have to understand and respect what the MBAs bring to the table and how they think, and it has to go the other way. That there has to be an appreciation of the medical professionals, what the social workers bring to the table and how they think, that we need to work more as a team. And I think this interdisciplinary focus is where universities can really make a contribution. If you look at Quinnipiac University, we have bricks and mortar that allow for this. We have actually, it's the old Anthem building that has the medical school housed with the law school, which is almost unheard of, housed with the social workers, housed with the PAs, all your ancillary personnel. So there's a chance for people to intermingle and interact in the hallways, in the lunchrooms, get to know each other, get to know how people think. We also offer, the business school offers courses where we have nursing students taking them and we have law students taking them. So I think universities can contribute to training the next generation healthcare leaders with an interdisciplinary focus. I also think that healthcare leaders need business skills, but they need a deep understanding of the unique domain of healthcare. So when you teach healthcare or you teach law, you really need to teach healthcare law, the things that impact healthcare, whether it's compliance issues, whether it's medical malpractice issues. It's the same thing with finance. You need to teach the Medicare reimbursement, Medicaid reimbursement. HR is really unique because you have physicians and you have CEOs and you have trustees and things like that. So, you know, we get compliments all the time because we offer skills specific with the healthcare unique domain. And people say, well, our students know something when they go into healthcare. So they're not just getting a flavor of healthcare, but they're really getting a deep dive into healthcare, which I think is very, very important in terms of talking about the unique domain that healthcare is. We're not producing widgets, we're producing good value and good outcomes in patients. I think COVID has told us that we need to train people with crisis management skills. I have been amazed, you know, and I've worked closely with American College of Healthcare Executives through this whole COVID thing, just as I say work loosely. I've kept in contact with them, met with them through my board membership, but I am in awe of their ability to really set up field hospitals and take care of patients and plan. So I think we really have to think about that. You know, this probably won't be our one and only pandemic in our generation. And that goes along with, we also need to train people with leadership skills and soft skills, emotional intelligence. And then what we started discussing, people need to understand what happens in both, as Matt said, the state legislature and the federal legislature impacts practice, and it also impacts the health of the communities we live in terms of social determinants of health and things like that. So I would say interdisciplinary focus, non-traditional learners we have to pay attention to. We're moving toward not just your generation of 18 to 22-year-olds, but how do we meet the needs of our non-traditional learners, those going back for degrees, those that want to move forward in leadership positions. And then how do we continue a partnership with the field, which I think is key to training anybody who's going to be a leader in their discipline, is getting that expertise from the field and matching it with the university expertise. So thank you.
Angela, you gave a lot of great points there. So I'm just going to add one more point, and I think there is one important pillar that has to be part of the training of the next generation of healthcare leaders, and that's really around the area of the impact that technology is going to have on healthcare delivery and healthcare quality. I mean, we are experiencing just phenomenal and very rapid changes in everything from artificial intelligence, machine learning, data analytics, and even wearable technologies that are going to impact healthcare. And these changes, it's really important, I think, that healthcare leaders understand the impact of these changes and can manage them and leverage them and get the most use out of them. And there's going to be some really challenging issues that arise. How will data analytics, be used in a way to improve quality outcomes? What are some of the security issues, not only for the institutions, but for privacy of medical records for patients? So I think really having a very strong understanding of the role and the impact and the future of technology is one more, and I guess a long list now of critical areas that healthcare leaders are going to need to be trained in and be educated in and really understand. And as Angela said, be able to put into practice when they get in their roles in a healthcare setting.
Okay. And so I think one of the themes that you were talking about, Angela, with having older learners or these non-traditional learners, that makes me think of age-friendly universities, which is one of the pillars of the age-friendly ecosystem. That's an article that Terry Fulmer wrote a couple of months ago. So just lots of different levers and things to keep your eye on.
Well, Quinnipiac is an age-friendly university. I can't take any credit for it because it happened when I was away doing this fellowship, but we have taken steps. we have some very dedicated people. Nick Nicholson comes to mind that are
That's
doing
great.
really good stuff in that particular area.
That's great. So you had mentioned kind of in your intro that you had had the opportunity twice to do this immersion experience on the Hill. So you were a Robert Wood Johnson Foundation Health Policy Fellow in 2000-2001 and served in the Senate on the Help Committee. And so maybe talk about the contrast that experience with your Health and Aging Policy Fellowship experience.
Great, yeah. So, I mean, 2000 and 2001, we can remember 9/11 happened, and then this year
Oh no.
happened. So
You've gotten two really good
thinking,
experiences.
I'm thinking maybe
Crisis
this might be an omen and should be my last immersion in DC.
We'd all appreciate it.
It's been, you know, first place, they have been wonderful experiences, and I would encourage anybody who has the opportunity to do it. And we'll talk a little bit more about how we can bring this to Quinnipiac and other learners. But, you know, my first impression is 20 years makes a significant difference. When I was a fellow on the U.S. Senate Health Committee, I was struck by the willingness that the senators and, you know, therefore the staff had to work across lines. The professionalism was amazing. You know, I think about the Kennedy Hatch friendship. You know, they couldn't be more diametrically opposed philosophically, but they worked together to pass significant healthcare related legislation and other areas of legislation. You know, one of the key things that I worked on as a fellow was patient safety legislation. So it was really a tripartisan effort with Senator Frisk at the time, Senator Kennedy, and Senator Jeffords' office. We were encouraged to work together. We were encouraged to find solutions. You know, it was a win for everybody. That was not necessarily the case on the Hill this time. You know, there was a lot of division along party lines, and sometimes you wondered if you could even say hello to somebody who was in a Republican office if you were in a Democratic office in the lunchroom. So there was really, I would say, a division that wasn't there 20 years ago, and really, I think, does our country an injustice when you look at it. I was fortunate enough to have a placement in Representative Rosa DeLaura's office, who is just amazing in terms of her energy and commitment. There was quite a difference between the placement on a committee staff in the Senate versus in a personnel office. You know, on a committee staff is really where the policy takes place, the sausage gets made, and you roll up your sleeves. The personnel office was really moving to me in terms of meeting with constituents. And also Rosa DeLaura is the chairman of the Labor, Health, Human Service, Education Related Agencies subcommittee of the Appropriations Committee. So we met with a lot of constituents around funding for various diseases, and it was really moving. You know, I think the importance of the advocacy can't be underscored enough. I remember one particular group that came in from cystic fibrosis. They came in with obviously the lobbyists and the various people from the advocacy organizations. And they also came in with two moms who were impacted by this. And this one mom brought a Russian stacking doll with her. On each of the dolls was episodes that her poor daughter had gone through and the cost of those episodes. You know, her hospital admission, her 10-day stay, her need to be put on a ventilator, the cost of her meds. That was so effective. You know, I still have the stacking doll with me. So I think one of the key takeaways is the importance of advocacy and also the importance of telling your story. You know, my father was a victim of a patient safety error, and he succumbed to that. And for years, I worked with the healthcare community, and I didn't really share my story, thinking it might impact my relationships with the healthcare community. And it isn't until recently that I have begun sharing this story, and I see it moves people to make a difference, to move forward. So I think, especially in a personnel office, the importance of advocacy, it can't be understated enough. But also telling your story is very, very important. And, you know, I am still in awe of Representative Delora. She is committed. She is high energy. You know, she is right now in a position to run for chairman of the Appropriations Committee, and has done a wonderful job in terms of supporting NIH activities. You know, that's another thing that really moved me, was the impact of COVID on research. Many people have been having to close their labs down, and this is going to create quite a lag in the ability to move forward with research. So, you know, funding and support of our dedicated individuals doing all this important research will be even more important when we get through COVID. So thank you, Melissa.
So, I mean, in terms of, you know, the role that Angela was able to play in the two immersion programs in DC, it's been great to be able to bring that back here to Quinnipiac, because it's that, you know, having that hands-on experience that a faculty member can bring not only into the classroom in working with students, but also to inform you know, research activities, and to be, you know, an outlet and a sounding board for other faculty, and to be able to support colleagues who are also interested in these topics, but have not maybe had the opportunity that Angela had with the two fellowships. So that's been a great, you know, kind of addition to, you know, our healthcare management, you know, programs here at Quinnipiac. And it's impacted not just students here in the School of Business, but you might have caught, you know, in Angela's introduction, she is a faculty member in the business school, but she also has an appointment with the medical school. And we have a unique medical school program in which the medical students have to do a year-long research project, but in an area outside medicine. So several of them will choose, you know, business, and they'll do a project in the business school. Some of those projects are around, you know, medical or healthcare policy issues, and Angela has, you know, been a mentor and an advisor to several of those projects as well. So that experience really has, in many ways, shaped the way our healthcare programs have evolved. They've definitely had an impact on our students. And they've actually, you know, also had an impact on other faculty, so Angela's colleagues. And we are, you know, hoping to replicate this for our students going forward. So one of the takeaways that Angela had from her most recent internship was to take a course that we have, but we're going to convert that under Angela's leadership into a student immersion program in Washington. So we'll probably do that, you know, kind of virtually this year, because we won't be able to travel. But the goal is to have a similar type of experience that we can do every year as an immersion program for our students going forward. And that goes along very well with, you know, one of our philosophies in the School of Business, which is to get students outside of the classroom and to work on real projects and to really engage with people. So we do a number of immersion programs with students, from, you know, international travel to meet with business leaders around the world, to this now, our most recent, you know, sort of rendition of this, which will be a student immersion program on healthcare policy that will occur annually in Washington, DC.
Okay. So two things, talking about students doing projects, you know, or a research project outside of their discipline. I'm actually working with a student from the School of Medicine, and but what we're working on as a collaborative project with Age Friendly DC to look at age friendly businesses. Like, what does that mean? What are the core parts of being an age friendly business? So I was just thinking, oh, I have 2 people here. Now I'll ask to review like these checklists that we're developing. And at first he was, looking at me like, why am I doing a research project on this? And I was like, well, the nursing homes are closed, so my funded research isn't going to happen the way it was supposed to with original data collection, since we can't get into the nursing homes. But that's, from my perspective, I was like, what, this is a great thing for you to do so that you understand kind of what it means to be age friendly in a business, but also in a health system. So there's a lot of different initiatives. So we're going to be doing that as part of a university seminar series that will be out, like talking about what an age friendly business is. So I might circle back to you guys.
Right.
And then the other thing,
Great.
talking about advocacy and the power of storytelling. I love the visual of the stacking Russian dolls. So what do you think the impact has been of the Health and Aging Policy Fellowship on your next career steps, Angela?
So I'm forever grateful for the opportunity of the fellowship. I am honored and privileged to be a Quinnipiac University Albert Schweitzer Fellowship recipient this year, which will allow me to continue this work. The Institute was established to introduce Schweitzer's philosophy of reverence for life to a broad audience. And what better way to do that than help bring policy and aging policy to our Quinnipiac community. So I'll be doing that, and I very much view that as a continuation of the work with the Health and Aging Policy Fellowship. As Matt said, we're going to establish this healthcare policy immersion program, and with a focus on interdisciplinary team of students, and also looking toward individuals who have the ability to make a positive impact on health policy development. So playing it forward and also developing those that might have an interest in aging policy or policy in general. And I think, I would encourage, I think about, I teach with a surgeon in the medical school, happens to be the chair of the medical staff, and he was doing our MBA while I was doing this fellowship. And I remember sitting in the Department of Health and Human Services lobby, which is this big lobby, just exhausted from this all day of orientation and everything, and thinking, why aren't I in the beach in Barbados instead of doing these, long days? And he's saying, why am I doing an MBA? And, I think if you are honored to have a calling for teaching, then you also need to have a responsibility to be a lifelong learner. And doing these fellowships and feeling the uncomfortableness of, finding a placement and doing a project develops empathy in me, but it also helps me bring back these experiences. And right now for me, where I am in my career, which is one step away from Barbados with the jazz bar, it's important to develop, whether it's partnerships with the field, whether it's experiences that I can then, pay it forward to meet my responsibilities and to meet the calling that this job is. So it makes you a better teacher to do these kinds of things. And, Matt, I'm going to let Matt talk about the MS in healthcare management that we're developing, but that would be also another way to, hopefully apply some skills and abilities and learn from my colleagues at Quinnipiac. Matt, do you want to say something about the MS in healthcare?
Yeah, sure. So this is another kind of next step here at Quinnipiac. So as Angela mentioned, in her list of pillars, one of those key pillars was an interdisciplinary approach to healthcare education. And she also mentioned that we have a med school, we have a law school, we have a school of nursing, we have a health science program with multiple disciplines. We have healthcare coverage in our School of Communication, We have some healthcare analytics and coverage in our College of Arts and Sciences. And we have an engineering school that's also interested in how they can kind of contribute broadly in the area of healthcare. And then within the School of Business, we have an MBA that allows a concentration in healthcare management, and we have a degree in organizational leadership that has a concentration in healthcare. And we have a business analytics program that has healthcare analytics courses as well. So our next kind of iteration and evolution is to develop a very interdisciplinary MS in healthcare management or healthcare administration. We're still kind of going back and forth on the exact title and scope, but it's in the planning stages right now, and it will be, as Angela said, kind of a very applied program pitched to people who are in the field working in a healthcare environment, but need additional training and additional credentialing really to kind of move forward in their careers and to be able to make the best contribution that they can within their organization. And so this has involved faculty from all of those schools that I just mentioned, but really kind of the leading schools are business, the School of Nursing, the School of Health Sciences, the med school, and the law school. So we're hoping to kind of finalize that design and get all of the courses designed and approved and the degree program approved this year or early next year with a launch soon thereafter. But it really will be the next evolution and kind of drawing together all of these different disciplines and how they work together and how they can all contribute to really building the next generation of healthcare leaders, at least here in Connecticut, but hopefully down the road and a much broader area as well. So we're really excited about that. And Angela will be, working with her colleagues on that program going forward.
Okay. Well, I would like to thank you both for being with me today and sharing your experience. So any final thoughts before we close out?
Yeah, I would be remiss if I didn't thank QU leadership. We have some really exciting leaders from President Olean to our provost, Deb Leibowitz, and Matt has been very supportive of developing interdisciplinary opportunities and developing partnerships with the field. And I very much appreciate that, but I certainly would be remiss if I didn't thank the fellowship office in Columbia University, Kathy Pike and Harold Pincus, who were just wonderful mentors and friends, and our funders who make this important work and experience possible. The John A. Hartford Foundation has been phenomenal in supporting aging and aging-related research and policy. West Health, CMS, and the VA. So I'm very grateful to our funders for their support of the fellowship and for this wonderful opportunity and for the opportunity to move it forward to our students.
And I'll just add, thank you, Melissa, for all the work you do in this area. Thanks to the Health and Aging Policy Fellows Program, which gave Angela this great opportunity. It's been great benefit to Quinnipiac, and I'm sure a great benefit to many, many other people. We really appreciate that. And we want to say thank you for the work that's done in that area as well.
Okay. Well, thank you both again. And thank you for being with us today.
All right.
Thank you.
Thank you.
Thank you for joining us for this special series of This is Getting Old. Sponsored by the Health and Aging Policy Fellows Program, Capstone Conversations is brought to you by Melissa B., PhD, in collaboration with the George Washington University's Center for Aging, Health, and Humanities. Thank you for joining me today for This is Getting Old. If you'd like to know more, you can subscribe to my YouTube channel, and if you have any questions or a related topic you'd like to hear from me about, just let me know. Thanks.